Francine, we need to speak with you.
I'm sorry, who are you?
We found out about the gift cards you've been handing out.
For nearly 2 decades, dozens of recovering addicts.
I walked into that place because I needed help. That's the part nobody talks about. Before the gift cards, before the logbooks, before any of it, I was a person who needed help. I had 2 little kids at home and I was losing them and I knew it. And I walked through that door because I was trying. The woman behind the counter smiled at me. She asked me questions. She wrote things down. She told me I was in the right place. And then she handed me a $50 Walmart gift card and told me there was another one waiting if I came back Tuesday. I knew what that card was for. She knew what that card was for. We both knew. She just needed my Medicaid number and a signature on a logbook. I just needed $50 badly enough that I told myself it didn't matter. It mattered. I found out later that for every visit I signed into that logbook, visits where I sometimes saw no one, talked to no one, just signed my name and walked back out, she was billing the state of North Carolina hundreds of dollars. I was a line item on a spreadsheet. My children were collateral, and there were 340 other people just like me. 68 of them are dead.
What Kaylee described in that federal courtroom in Greenville, North Carolina, was not an isolated transaction. It was the operating model of a substance abuse treatment facility that had been running the same scheme for 15 years, systematically exploiting the people it was licensed to help in order to generate fraudulent Medicaid billings worth $15,300,000. Her name was Francine Sims Super, 61 years old, office manager of Life Touch LLC in Kinston, North Carolina, the woman the facility trusted with every piece of paper, every billing code, every audit response, and every patient file. Between 2007 and 2022, she orchestrated one of the most calculated healthcare fraud schemes in the history of the Eastern District of North Carolina. She paid drug-addicted patients in Walmart gift cards in exchange for their Medicaid numbers and their signatures on session logs for treatment that was never provided. She billed North Carolina Medicaid for sessions that never happened, patients who were incarcerated, patients who were dead. She coached patients before state audit interviews on what to say and what not to mention. She moved nearly $1 million in cash to a safe hidden behind a false closet wall in her son's house in Texas when she sensed the investigation closing in. And when federal agents walked through her office door on the morning of February 9th, 2023, her first response was to reach for the locked drawer where she kept the gift cards. Francine Sims was born in October 1961 in Snow Hill, North Carolina, a tobacco town of fewer than 1,500 people, 30 minutes north of Kinston. Her father, Wendell, worked the curing barns at a county tobacco cooperative. Her mother, Velma, kept the books for a small farm supply store on Highway 58. She grew up in a 2-bedroom clapboard house with peeling paint and a window unit in the kitchen. She was the second of 4 children, the first to finish high school, the first to leave Greene County. By the time she walked out of Greene Central High School in 1979, she had already been working part-time at a doctor's office, filing insurance claims by hand. The office manager called her the most organized 17-year-old she had ever met. That phrase would follow her for 4 decades. She earned a 2-year certificate in medical office administration from Lenoir Community College, paying for it herself, working evenings in the campus cafeteria. Her first full-time job was as a billing clerk at a family medicine practice. Starting wage, $4.25 an hour. She stayed 11 years. In 1992, she married Curtis Super, a long-haul trucker. 2 children, Brandon, born 1993, and Tabitha, born 1996. The family settled in a brick ranch in Kinston on a quiet street lined with crepe myrtles. Francine took a position as billing supervisor at a small mental health clinic on Vernon Avenue. Her supervisor wrote in a 1999 evaluation that she anticipated compliance issues before they surfaced and demonstrated an exceptional grasp of state Medicaid procedures for someone without a 4-year degree. She was promoted to office manager in 2001. By 2004, she had passed the Certified Professional Coder examination on her first attempt. She kept the framed certificate above her desk for the next 20 years. Friends from that period describe a woman who brought casseroles to co-workers' funerals, sat in the front row of every school choir concert, and ran a front office with a precision that made auditors comfortable and bosses unworried. She was, by every account, the woman you trusted with the paperwork no one else wanted to touch. In 2007, a man named Reginald Whitlow opened a small substance abuse counseling practice in Kinston called Life Touch LLC. When he asked around about who could run his back office, 3 different people gave him the same name: Francine Super. He hired her on a Tuesday. She started the following Monday. Starting salary $46,000. By 2018, she was making $138,000. By 2022, she was the highest paid employee at LifeTouch, higher than the licensed clinical staff, higher than the medical director, higher than the man who owned the company. LifeTouch sat in a strip mall on West Vernon Avenue between a tax preparer and a discount tire shop. The waiting room had 8 folding chairs and a coffee maker nobody refilled. The treatment rooms smelled like industrial carpet cleaner. The facility billed almost exclusively to North Carolina Medicaid. Its patient population came from the poorest counties in the eastern part of the state: Lenoir, Greene, Wayne, Pitt, Duplin. Most were addicted to opioids, methamphetamine, or both. Many had open warrants. Many had children in foster care. Many were one bad week from sleeping in a car. For each patient, Medicaid paid LifeTouch between $85 and $430 per session, depending on the service code billed. A single well-coded intake could generate $430 in reimbursement for less than 90 minutes of work. In theory, the system had safeguards. Patients had to sign in. Counselors had to document. Progress notes had to be tied to treatment plans. Random audits could be triggered if billing volume spiked beyond regional norms. In practice, the safeguards depended on one thing: documentation. Whatever Francine Super signed off on, North Carolina paid. Whatever she filed in response to an audit request, the auditors believed. She had been doing the paperwork without complaint for 11 years before anyone in Raleigh thought to question it. North Carolina, like most states, allowed substance abuse facilities to provide small patient incentives to encourage attendance: coffee, snacks, occasional gas cards under a strict dollar limit, $20 per patient per visit, $50 maximum per month, tracked, signed for, audited. The rule existed because missing a session sometimes meant missing a paycheck. Francine understood that rule better than anyone in the building. She had also figured out that nobody outside the building knew it existed. The first gift card was handed out on a Thursday in March of 2017. A man named Deshawn, 26 years old, 4 months out of a correctional facility, recently relapsing on heroin, walked into LifeTouch looking for a methadone referral. He was told he had to be assessed first. The intake counselor wrote up a comprehensive clinical assessment. Francine billed Medicaid $430. She walked Deshawn out to his car personally and pressed a $50 Walmart gift card into his hand. She told him there was another $50 waiting if he came back the following Tuesday. Deshawn came back, then the Tuesday after that, then twice a week for the next 11 months. Each visit generated a session note he never read. Each session note generated a Medicaid claim. Each claim generated a check. By the end of 2017, LifeTouch had billed Medicaid more than $700,000 on Deshawn alone. The pattern, once established, required only her management. She kept a notebook, green canvas cover, spiral bound. In it, she logged patient initials, gift card amounts, dates of distribution, and session codes billed against each patient's name. She kept the notebook in a locked drawer. She kept the gift cards in a separate locked drawer. The keys lived on a lanyard around her neck. Over the next 5 years, the operation expanded. She trained 2 front desk staff to distribute cards under her supervision. She found a wholesale distributor that sold Walmart and Target gift cards in $5,000 lots. She negotiated with a methadone clinic in Greenville to refer patients who were compliance ready. She began coaching high-volume patients before audit interviews. Repeat the session times. Mention the counselor by name. Do not mention any cards. Some patients signed logbooks and walked straight back out without seeing anyone. Phantom visits, billed as full sessions. Some came twice a day. Some came in on days they were too impaired to remember coming at all. The ones who refused to cooperate were quietly removed from the active roster. The ones who stayed received cards every visit. Every visit was money. The billing numbers climbed steadily. 2017, $2.1 million. 2018, $3.8 million. 2019, $4.4 million. 2020, $4.1 million, even through the pandemic, because Francine had transitioned a third of the billing to telehealth codes and was now paying patients to answer a phone for 15 minutes. By 2022, LifeTouch was billing Medicaid at a rate exceeding the next 3 competing facilities in eastern North Carolina combined. Reginald Whitlow, the owner, was paid a salary of $300,000 a year and asked very few questions. The clinical staff were paid above market and discouraged from examining billing codes. And Francine's son, Brandon, 26 years old, no medical background, was placed on payroll in 2019 as a compliance consultant at $110,000 a year. Brandon had moved to Katy, Texas by then. He performed no compliance work. He cashed the checks. The signs were everywhere. A 2-room storefront billing more than a regional hospital outpatient program. An office manager driving a 2021 Cadillac Escalade. A Brunswick County beach condo purchased in cash, a house in Katy, Texas in Brandon's name with a basement gun safe and a backyard pool. No one noticed, no one checked, until somebody did. April 2022, an analyst at the North Carolina Department of Health and Human Services Program Integrity Unit named Pamela Hutchins ran a routine quarterly comparison of substance abuse facility billing volumes against patient census numbers. LifeTouch LLC sat at the top of her spreadsheet. Its billings were 41 standard deviations above the regional mean. Its patient retention rates were nearly perfect. Its no-show rate was effectively 0. Hutchins flagged the file and wrote one sentence in the case management system. Numbers do not appear physically possible for a 2-counselor outpatient operation. The flag went to the Federal Health and Human Services Office of the Inspector General. Special Agent Marcus Yelvington, former North Carolina state trooper turned federal investigator, was assigned the case in May of 2022. He requested patient billing records under a routine administrative subpoena. Francine produced them within 48 hours, organized in 3-ring binders, color-coded by service line. Yelvington spread them across his kitchen table that weekend. He ran patient names against criminal records, employment data, and death records. By Sunday night, he had found 17 LifeTouch patients who had been incarcerated in a North Carolina state prison on dates the facility had billed for in-person sessions. He had found 4 patients who were dead. He had found 1 patient billed for 32 sessions in a single calendar month, a logistical impossibility for an outpatient program operating on a 5-day schedule. He drove to Raleigh on Monday morning and met with the United States Attorney's Office for the Eastern District of North Carolina. By Wednesday, the case had been opened as a federal healthcare fraud investigation. For 7 months, Francine knew nothing. She drove to work. She ran the front office. She handed out gift cards. She filed audit responses to the very state agency that was now sharing its records with the grand jury investigating her. Then somebody talked. A former LifeTouch patient named Kaylee, 29 years old, 6 months sober, trying to regain custody of her 2 children, walked into the federal building in Raleigh in October of 2022 and asked to speak with whoever was investigating her old treatment program. She had been called to testify in a custody hearing about her recovery. A judge had asked her to describe her treatment. She had told the truth. She told it again to Special Agent Yelvington. 11 hours of recorded testimony over 2 days. She named names. She described the notebook. She described the lanyard around Francine's neck. She described signing logbooks for sessions that never happened, receiving cards she knew exactly what she would use them for, and being coached on what to say if anyone from the state ever called. Yelvington moved immediately. On October 19, 2022, federal agents executed simultaneous search warrants at 3 locations: the LifeTouch office on Vernon Avenue, Francine's home in Kinston, and the house at 4218 Honeysuckle Drive in Katy, Texas, registered to Brandon Sims. The LifeTouch office yielded 47 evidence bags, the green spiral notebook, 3 years of forged audit response files, a locked cabinet containing $83,000 in unsold gift cards, a handwritten list of 17 patients with red check marks beside the names of those who had been coached before audit interviews. The Kinston house yielded 19 more bags, a safe in the master bedroom closet containing $142,000 in cash, bank statements for accounts in the names of Francine, Curtis, Brandon, and Tabitha, showing combined deposits of more than $4 million over 5 years. Title paperwork on the beach condo, paid in certified checks, and in Katy, Texas, behind a false closet wall in the basement of the Honeysuckle Drive house, agents found a Liberty brand floor safe bolted to the foundation. Inside, neatly banded in stacks of $100 bills, $997,000 in cash. The bands carried tape strips dated September of 2022, exactly 7 days after Brandon Sims had received a 2-minute phone call from his mother. The text messages recovered from Brandon's phone dated September 14, 2022, told the rest. We may have a problem. Pull what you need to pull. How much? All of it. The Greenville account too. Don't leave a paper trail. Where do I keep it? Somewhere they would never look. Not the bank. Got it. The smoking gun was not the cash. The smoking gun was the timing. February 9, 2023, 9:47 in the morning. Francine had been at her desk for less than an hour, navy cardigan, reading glasses on a beaded chain around her neck, reviewing a Medicaid claim summary. Special Agent Yelvington and 2 HHS OIG investigators walked through her open office door. She looked up. Francine, we need to speak with you. She turned in her chair. Her hands moved instinctively toward the locked drawer. I'm sorry. What? Who are you? We found out about the gift cards you've been handing out to patients. She shook her head, firm, practiced. I have no idea what you're talking about. Those are patient incentives. That's standard. $1 million in Walmart cards is not standard. Her voice rose. The reading glasses chain swung against her sweater. That is absolutely not. You have the wrong woman. I run a clean program. Yelvington watched her face. He had been told by Kaylee what to look for, the slight tightening at the jaw, the hand drifting toward the lanyard at her neck. He did not raise his voice. He laid a single document on her desk, a printed copy of the September 14th text exchange between her and her son. He turned it so she could read it right side up. She read it. Her eyes moved from the first line to the last. She did not blink. Francine, he said quietly. Brandon was arrested in Katy at 6 this morning. The safe is open. We have everything in it. I need you to stand up, turn around, and place your hands behind your back. She stood. She did not say another word until her attorney arrived 9 hours later. After 11 months of pre-trial motions, 3 suppression challenges on the search warrants, 2 challenges to the grand jury's reliance on Kaylee's testimony, all denied. Francine Sims Super signed a plea agreement on January 22, 2026. 7 consolidated counts: healthcare fraud, money laundering conspiracy, aggravated identity theft, tax evasion. Brandon Sims pleaded the same week. 46 months, forfeiture of the safe contents and the Honeysuckle Drive house. Reginald Whitlow, the owner of Life Touch, had signed a cooperation agreement before the indictment was even unsealed. He pleaded to a single felony count. He received probation. He now sells insurance in South Carolina. Sentencing was held March 11, 2026, before Judge Letitia Voss in the United States District Court for the Eastern District of North Carolina in Greenville. After Kaylee read her statement, both hands on a single sheet of paper, eyes on the judge, not once looking at Francine, Judge Voss spoke for 9 minutes. The relevant portion lasted 30 seconds. Ms. Super, you found a population of people whose addiction made them incapable of refusing what you offered, and you weaponized their disease against them and against the program designed to help them. You did this for 15 years. You did it well enough that no one caught you. You hired your son into the scheme and taught him how to hide cash. And when you sensed the investigation closing, your first instinct was not to stop. It was to move the money to a basement in Texas. The court does not believe you have ever felt remorse. The court believes you have only ever felt caught. 72 months in federal prison. 3 years supervised release. Restitution of $15,300,000 to North Carolina Medicaid. Restitution of $373,000 to the IRS. Forfeiture of the beach condo, the Katy house, the Cadillac, the cash, and her primary residence in Kinston. She is currently incarcerated at the federal prison camp in Alderson, West Virginia. Projected release, January 2031. She will be 69 years old. Life Touch LLC was permanently barred from billing North Carolina Medicaid. The storefront on Vernon Avenue is now a payday loan office. The waiting room chairs were sold at auction. Of the 341 LifeTouch patients identified in the federal indictment, 68 died of overdose between 2017 and the date of sentencing. The federal complaint does not allege that Francine's scheme caused those deaths. It does note, in a footnote on page 81, that none of those patients received any treatment beyond a signature, a session note, and a $50 gift card.
I have my children back. I want to say that before anything else because it is the thing I am most proud of and the thing that almost didn't happen. When I walked into that federal building in Raleigh and asked to talk to someone, I didn't know what it would lead to. I just knew that a judge had asked me to describe my treatment and I couldn't lie about it in a courtroom, not when my kids were sitting there waiting to come home, so I told the truth. What I want people to understand is that when you are in active addiction, $50 is not a small amount. $50 is the difference between a decision you can live with and one you can't. She knew that. She had been watching people like me walk through that door for 15 years. She understood exactly what that card would do to us. She handed it over anyway. Every single time. There were 68 people who walked through that door the same way I did, who signed the same logbooks, who took the same cards, who never got any actual help. Not one session, not one counselor, not one real conversation about getting clean. They are gone. I think about them. I think about what might have been different if the money that paid for my gift cards had paid for real treatment instead. Real counselors, real sessions, real help for people who were trying. Francine Super will be 69 years old when she gets out of prison. I will be 44. My children will be teenagers. And the 68 people who walked into that strip mall on Vernon Avenue looking for a second chance will still be gone. That is the part no restitution order covers. That is the part that stays.